Some new information shows African American mothers are still dying at an alarming rate during childbirth, more than any other ethnic group.
Action News' Jackson Tishabariola is covering this crisis, taking a look at the numbers. Letitia, we have this information now because of a new checkbox that's been added to death certificates on all 50 states.
Yes, it's going to help them track this. You know, this information was just released this morning, and obviously it's something important to me, but really all women should survive childbirth, right? So that's why we're digging into these numbers. It's alarming. The CDC says that they found about 700 mothers die each year from complications from pregnancy or childbirth. And this is what's important. 60% of those are preventable. We can save some lives here. So this new checkbox on the death certificate show 658 pregnant women died in 2018. Black women died 2.5 times more often than white women. Hispanic women had the lowest rate of maternal mortality. They have the best outcomes here. Now, researchers do not have a clear explanation. It is complicated and layered, but they say it could be caused by a combination of institutional racism or unintentional bias in the healthcare system. That's being talked about a lot right now. And by Black women's increased risk of health problems like high blood pressure, and the fact that Black women are also less likely to have access to quality prenatal care. So last April, I did a story on African-American baby deaths in Florida, and I found more infants die in Northeast Florida than any other part of the state. CEO of Northeast Florida Healthy Start Coalition, Faye Johnson, says that number, it really says a lot about our city.
Unfortunately, infant mortality is a central indicator of your city's health.
She's saying it's not just women's problem, it's all of our problem here. Northeast Florida Healthy Start Coalition reviewing 147 cases from 2017 where babies didn't live to their first birthday. Before the checkbox, maternal deaths were not even being coded properly in a lot of cases, which led to some being underreported, overreported. It is so critical to get the numbers right so trends can be identified and we can save some lives.